Coronavirus cases are dropping in Colorado. Now the state is allowing counties that were once in level red to move to level orange. Joining me now is CBS4 medical editor Dr. Dave Hnida. And Dr. Dave, the change in levels means indoor dining will be allowed again at restaurants. So do you think now is the right time to relax these restrictions?
Yeah, I think on the one hand, it really sounds like it is a great thing to be able to do. On the other hand, I think there comes a degree of a little bit of concern over whether or not this is a appropriate time to do so. I think that when you look at it from the positive aspects, it's good news for restaurants. I know that it's not quite as much as restaurants would like to have, but at least it's something from an economic standpoint. It will help restaurants and will help people who work at restaurants. I think for the population in general, for folks, it will give them another opportunity to get out of the house and relieve some of the pandemic fatigue. And I also think for some people, when you think about it, if they are given the opportunity to get out of the house, perhaps they will be a little less prone to having large gatherings in their own homes, which in and of themselves may in fact be a little bit more risky than going and having a meal. On the other hand, when you take a look at the possible downsides of reopening up things, I think that we are not really sure where we are numbers-wise. We have not yet seen what is going to happen post-holiday. We're probably not going to know that for a few weeks. And so we could be looking at another surge. We're just not sure. Number two is we have a new strain of virus. We know that's going around. We know that it's here in Colorado. How is that going to impact our numbers in the times to come here? And I think that we really are also really wondering what is going to wind up happening as we just take a look at trying to get vaccine rollout into place. I know a lot of people are feeling confident about that, but we have had some glitches, and we really don't know where we're going to be in the times to come. And so even though our numbers are looking better in terms of COVID cases in Colorado, we still are well above where we were in the worst part of spring of last year. We still have more hospitalizations. We still have a higher positivity rate. So at this point in time, I'm still hopeful that, yes, it'll be a good thing that we reopen a little bit more. The big question is, will we hopefully not have to pull back in the weeks ahead?
Right, and let's talk about that new and more contagious strain of coronavirus that has been detected here in Colorado. If you've already had COVID, can you still get this new strain?
Well, when you think about it, if you have already had the so-called older, non-mutated strain, we do know that it is possible that you might still be infected by that again. We have had people get reinfection. We have people who have tested positive for COVID, even though they've already been infected one time around. So obviously, having a new strain, the answer to that is, yeah, you could be infected by a new strain. We do not know how long your natural immunity lasts after having just the non-mutated strain of COVID. And now we have the new question of what is going to be the deal with the new strain coming in. I think that is why we are still continuing to emphasize the fact that whether you've had COVID in the past or not, you still need to follow the guidelines and recommendations of wearing a mask, practicing social distancing, and making sure that you still get a vaccine even if you've already had COVID. We simply do not know how long natural immunity lasts. So the biggest message to come out of this question is really, you need to continue to practice the behaviors that will ensure that you stay healthy, as well as helping to keep our community healthy.
Yeah, certainly not time to let our guard down. The U.S. government is in talks with Moderna about the possibility of giving out the vaccine in half doses. What would be the benefits and also the disadvantages of that?
Yeah, this is an idea that has just recently been floated by the head of Operation Warp Speed. And really the idea is that you cut the dose of the Moderna vaccine in half. you cut the dose of the Moderna vaccine in half, and then you wind up being able to use more vaccine. In other words, if you are getting, say, 50 vaccinations out of a vial, if you wind up giving half of the dose, you will now be able to get 100 doses of the vaccine out of a vial and therefore be able to vaccinate more people. Now, the downside of that is, number one, does it wind up still providing the same level of immunity? Number two, it's very limited in terms of the group that it would be used for. In other words, it would only be those between the ages of 18 and 54 with otherwise healthy lives. In other words, no underlying health conditions. So it's a very limited number of people that would be eligible to undertake this sort of regimen. And even if you wind up going with a half-dose regimen, you still need to have a second booster dose done weeks later. So there is that aspect to continue to consider in this. I think the other thing to keep in mind is the problem right now, it's not really the amount of vaccine we have. The problem is rollout of vaccine and getting the vaccine into the arms of people. So right now, trying to get more out of a vial is a great concept, but the thing is we still have vaccines in vials that are not being distributed and they're not being administered. And that is what I think the issue that needs to be worked on truly is.
That's interesting. And with vaccinations underway, what are public health experts thinking about the future of the pandemic? Do you think we can expect to see more spikes in the future?
I think there is a level of concern about how things are going to be in the months to come. I think that we do have the possibilities for surges and higher case counts in the months to come. We are still in a winter indoor season of colder weather. We do have a new strain that is going around, and I think that we are really worried that we are going to see just some spikes coming along through here. And you combine that with the fact that, once again, vaccine rollout has been really not what we would like to see at this point in time. But having said that, I think that many public health officials are optimistic. We really think that in the months to come, things will look better. I think there is going to be a change in how programs are being administered. I think there will be more cooperation between the federal government as well as state government, because the states can't do it by themselves. The federal government cannot do it by itself. I think there's going to be more cooperation. I think you're going to see the Defense Production Act be signed into effect in order to accelerate the availability of testing, of PPE, of the materials and supplies that are needed to give vaccines. I think you're going to see increased mobilization within the communities in terms of getting vaccines into the arms of people. You are going to see larger community testing sites. You're going to see mobile testing and vaccination units. And I think that what will wind up happening here is we will be able to expand the number of people that we are vaccinating in the time to come. I think we are also going to see some mobilization of the military in this, in terms of the reserves, in terms of the Army Corps of Engineers to help administer vaccines, so we will be able to do much, much more. I think that we really need to kick into a 24/7 vaccination mode at this point in time. This is truly a public health emergency. So I think if you want to sum this all up, I think we're looking at I think what we are going to see is infection rising, continue to rise over the next several months. But as we see vaccinations begin to go up, there will be a point in time where those lines intersect. And as soon as we start getting more vaccine into people, you will see a dip in the number of infections that are going on and present in the United States and in Colorado. And I think that we can look forward to that as we head into the latter part of spring. And certainly there is a lot of cause for optimism as we head toward the summer.
Great, still so much ahead. Well, Dr. Dave, thanks so much for joining us. Great information as always. We'll talk to you next Monday at 11 a.m. to get more coronavirus and vaccine questions answered. And remember, to see all of our Q&A with Dr. Dave segments, just visit cbsdenver.com. We'll be right back.